Welcome and thank you for joining. My name is Beatrice Paches and I am the Health Educator for Community Health at Atlantic Health System. Today's webinar, Managing Celiac Disease and Eating Right, is presented by Natalie Barbaro, Registered Dietitian at Morristown Medical Center. Before we begin, I have a few announcements. This webinar is being recorded and will be shared in its entirety on our website. All participants are muted. If you have a question, please use the Q&A button for questions or chat button for comments. We will try to get through all questions at the end of the presentation. Our Healthy Aging program at Atlantic Health System is a great resource to assist you or a loved one with obtaining many helpful services and information on topics of interest. For a comprehensive list of services, you can visit atlantichealth.org/senior services. I am now going to turn it over to Natalie.
Thank you. Hi, everyone. It's a pleasure to be here today. Thank you for joining. If you don't mind just giving me a couple minutes just to share my slides. All right, thank you. So again, thank you for the introduction, Beatrice. My name is Natalie. I'm the outpatient dietitian at Morristown Medical Center. It is a pleasure to be here today. So today we're going to be talking about managing celiac disease and eating right. So by the end of today's presentation, you will be able to list at least 2 indicators of celiac disease, describe at least 2 long-term effects if celiac disease is left untreated, and list at least 2 examples of a gluten-free diet. Okay, so what is celiac disease? It is a genetic autoimmune disorder that affects 1 in 100 people worldwide. Only 30% are properly diagnosed. So during today's presentation, we will also be talking about ways to diagnose celiac disease. It is an autoimmune disorder is when the body begins to attack normal cells because the body cannot differentiate between healthy and foreign cells. In order for a person to develop celiac disease, they must have either the CLA-DQ2, sorry about that, or HLA-DQ8 gene due to the fact that it is genetic. So there are 2 genes that the people need to have in order to have celiac disease because it is genetic. It is an allergy to gluten. Gluten is a protein found in many grains. Individuals with a parent, child, sibling who have celiac disease have a 1 in 10 risk of developing the disease themselves. It may develop at any age after the gluten is initially consumed. If a person with celiac disease eats gluten, the immune system will send a response to attack the small intestine. The immune system's response leads to damage to the small intestine and part of the villi. The villi is important for vitamin absorption. When the villi is damaged and is left untreated, chronic malabsorption and gastrointestinal symptoms may occur. In order to prevent that, avoiding gluten lifelong is recommended. For any visual learners like myself, if you look at the top of the screen in the middle, you'll see a picture of the small intestine. On the inside, we'll show a picture of the normal gut. So on the left, you'll see a picture of the villi that's sticking up, similar to like hair-like follicles. The villi, again, is important for vitamin absorption. In a patient who has celiac disease, because of ingesting gluten and the inflammation and the body's response to attack the small intestine, the villi becomes flattened. A flattened villi does not allow for vitamin absorption. So then we start to see malabsorption and some weight loss as a result. So it just is a great visual to show you that a normal healthy gut will have good active villi sticking up to absorb the vitamins in the absorb the vitamins and the minerals. And then a patient with celiac disease has that flattened villi where vitamins and minerals are not getting absorbed. Indicators of celiac disease for children are listed here. Gastrointestinal symptoms are the most common symptoms in children. So that would include abdominal pain and bloating, chronic diarrhea or constipation, failure to thrive, which can be indicated as underweight, significant weight loss, or more of like a short stature for their height, for their age, delayed puberty, any gas, nausea, and vomiting, as well as pale, foul-smelling stools. That is related to fat malabsorption, just from the dietary fat that we're consuming that's not getting absorbed, that gets passed through the stool, and then weight loss as well. Other indicators include anxiety and depression, attention deficit hyperactivity disorder, also known as ADHD, any learning disabilities, as well as damage to tooth enamel, fatigue, headaches, iron deficiency anemia, irritability, seizures, and lack of muscle coordination, as well as short stature. So these are all indicators related to pretty much predominantly malabsorption, malnutrition, and then not getting the right vitamins and the minerals that we need to thrive. The most common symptoms that occur in adults are the following. These include abdominal pain, bloating and gas, constipation or diarrhea, nausea and vomiting, mouth ulcers or canker sores, osteoporosis and osteomalacia. Osteomalacia is the softening of the bones. It's also related to, or other factors can occur, include reduced functioning of the spleen, hyposplenism, and weight loss. Cognitive impairment, depression and anxiety, fatigue, headaches and migraines, iron deficiency anemia, any itchy, blistery skin rash, that would be known as dermatitis herpetiformis, joint pain, any missed periods, peripheral neuropathy or nerve damage, and then vitamin deficiencies. Folate and vitamin B12 are very common vitamin deficiencies, but we can also see the fat-soluble vitamins that are deficient, such as vitamin A, D, E, and K. That would be more of a long-term untreated celiac disease and that constant gluten exposure. So how is celiac disease diagnosed? There's a few ways to properly diagnose celiac disease. An intestinal biopsy is considered the gold standard for diagnosing due to confirming celiac disease. Blood tests are completed to measure the body's response to gluten. Prior to having any of the blood tests, gluten avoidance should be avoided, meaning we should actually be ingesting gluten prior to having a blood test to see how our body reacts to that. If a person is avoiding gluten and is having a blood test, it could be a false negative. So unfortunately, those symptoms can be unpleasant, but ingesting gluten is recommended when having a blood test to make sure it is a true diagnosis. The IgG or IgA DGP tests are appropriate in IgA deficient patients. An IgA deficiency is a genetic immunodeficiency condition. Individuals that have this deficiency do not make IgA antibodies or have very low blood levels of the IgA antibodies. If an IgA test is completed, a patient would receive a false negative reading. So in that case, the other test would be recommended if they are IgA deficient over here, the IgG or the IgA DGP. AmAware is a home blood test that reviews 5 biomarkers and provides a convenient way to test for celiac disease. This test can be ordered by anyone over the age of 18. Lastly, an upper endoscopy can be completed to determine if inflammation is present or if there is damage to the small intestine. So just as a reminder, with celiac disease, there is a damage to the small intestine. The body is sending a reaction to attack the small intestine where the gluten is digested. So the endoscopy shows that there's any inflammation or damage to the small intestine, and that would confirm a celiac disease diagnosis. How is celiac disease treated? People who have celiac disease need to avoid gluten for life and limit any accidental exposures in order to prevent the long-term effects or side effects from consuming gluten. So looking at labels is very important. We'll discuss label reading in a little bit, but avoiding gluten is the treatment to really help manage those conditions. It's avoiding the gluten. Food sources of gluten in wheat. These are generally the sources that we want to avoid, which would be wheat. All types of wheat need to be avoided for patients with celiac disease, as well as barley, rye, malt, oats, unless they're gluten-free. Naturally, oats or oatmeal would be gluten-free, but due to cross-contamination, due to how they're being processed in factories, we recommend that the label would say certified gluten-free to ensure that there's no cross-contamination of any wheat from pasta or breads, just to make sure that that product is gluten-free. Other terms for wheat are listed here: bromated flour, durum flour, enriched flour, farina, regular flour, graham flour, phosphated flour, whole wheat flour, self-rising flour, semolina, and white flour. So there's quite a few, as we can see, different types of flours that do contain gluten that need to be avoided. And then food sources of gluten made from barley. This is a list of foods and ingredients that should be avoided on a gluten-free diet. Gluten-free beers are available and safe to consume for patients with celiac disease. So generally for beer, it's usually made from barley, depending, or there's malt beer. So the gluten-free would be the safest bet, and try to avoid regular beer. Other types of vinegar are safe to eat on a gluten-free diet, such as apple cider vinegar, wine, balsamic, and distilled vinegar, but malt vinegar would be needed to be avoided. Other foods that may contain gluten are listed here. Gluten is a common additive in foods due to providing texture. Common foods and beverages that contain gluten that need to be avoided on a gluten-free diet include imitation crab meat, soy sauce, and certain vodkas due to being made with wheat. Traditionally, vodka would be made with potatoes. Nowadays, we're seeing vodka being made with wheat. So that's something to consider, is just trying to find a gluten-free vodka and having it not be made with wheat, if that's something that you're consuming or know someone with celiac disease is consuming. Other products that may contain gluten include toothpaste, cosmetics, children's Play-Doh, lipstick, lip gloss, lip balm, skin and hair products, and communion wafers. So if you or a loved one or a friend is using any makeup or cosmetics, it is important just to look at that label and see if it mentions that it is gluten-free, just because it is that binder. It does change the texture of things. It acts as an emulsifier. So having products that we wouldn't even think about that might be being used on our skin that can still get absorbed. As a reminder, our skin is our biggest organ, so things can still get absorbed through our skin. So having products be gluten-free would also be recommended if there's that possible of absorption. Some medications, as well as vitamin and mineral supplements, may contain ingredients made from wheat or barley. It is recommended for a patient with celiac disease to speak with their doctor or their pharmacist about their medications that they're taking, or contacting the manufacturers if the pharmacist or the doctor doesn't know if that product could be gluten-free, and just confirming, just all the ingredients in that medication. Some supplements will list if it's gluten-free or not, so just checking the label of any vitamins or minerals, any herbal supplements would also be recommended. Label reading is very important for patients with celiac disease. It is necessary to have the certified gluten-free label on packaging. Under the Food Allergen Labeling and Consumer Protection Act of 2004, if a food or an ingredient contains wheat or protein from wheat, the word wheat must be clearly stated on the food label. Some ingredients containing modified food starch, dextrin, caramel color may be derived from wheat. Due to the labeling requirements, if an ingredient contains protein from wheat, the word wheat must be clearly stated. It can be included in the ingredient list or separate in the contained statement. This applies to flavorings, colorings, and any food additives as well. If a spice or seasoning mix contains wheat, it must be stated on the food label. So here I have shown is an example of a food label. As we can see on the Fiber One cereal, it has different labels on the box of the cereal. It says it's whole grain guaranteed. It talks about 51% of the daily looks like value of fiber. And then in the ingredients, it might be a little bit difficult to read, but the first ingredient is whole grain wheat. So right there, we can see that this product is not gluten-free. And then if we look underneath in bold after vitamins and minerals, there is a bold letter that says contains. In this area on a label, if they have this part, this will be where they'll list common allergies. So the first allergy is wheat. The second is walnut, almonds, and milk ingredients. For the sake of celiac disease, the only allergen that we have to be concerned about is wheat. That would say the wheat or would say gluten. But any nuts, seeds, milk, that would be safe to consume for someone with celiac disease. So looking at the label is important. If you're doing food shopping for someone with celiac disease and there's a lot of ingredients and it's hard to remember what ingredients to avoid, what you want to look for, of course, is just on the label that it says certified gluten-free. So these are the common labels that'll be included on the product. I always recommend for a patient with celiac disease, if you don't see this label on the box, just leave the box on the shelf and try to find another product, just because it could not be gluten-free. Even if you're familiar with the ingredients, none of them seem to have gluten. Let's say you're just buying lentils. Lentils are gluten-free, but if it doesn't say gluten-free, it could have a cross-contamination issue depending on how those lentils were processed in a factory that could have also produced bread, and then there's a risk of cross-contamination. With cross-contamination, the patient with celiac disease can still have symptoms, even if it's just a very small exposure. So those are things to just be aware of and consider. These are a list of gluten-free seeds and grains. Amaranth, arrowroot, buckwheat, cassava, corn, flaxseed, Indian rice grass, montina, it's also known as jobs tears, which is actually I have not heard of until I was planning for this presentation. So there are some grains, even as a dietitian, that were new for me to learn about. Legumes, which are beans, those will naturally be gluten-free, as what millet is another ancient grain. Finger millet, nuts are also gluten-free. Potatoes, quinoa, rice, and corn are gluten-free. Any seeds, soy products would be gluten-free in their natural form, but if it's a processed product and they're using gluten as a stabilizer for texture or anything else, then you would just want to look on that label and make sure it's certified gluten-free. But in their natural form, these products would be safe to consume on a gluten-free diet. Complications of celiac disease is untreated. So this is a list of conditions that unfortunately can happen if celiac disease is left untreated. That includes early onset of osteoporosis or osteopenia, heart disease, infertility and miscarriages, iron deficiency anemia, lactose intolerance, liver failure, malnutrition, neurological symptoms like we spoke about earlier, such as attention deficit hyperactivity disorder, headaches, loss of muscle coordination and balance, seizure, dementia, neuropathy, multifocal leukoencephalopathy is a disease that attacks the brain. Patients with this disease have difficulty moving, thinking, and feeling sensations. Pancreatic insufficiency is another complication that can occur, which is going to be the lack of proper digestive enzymes to digest our food, small intestine cancer, and non-Hodgkin lymphoma, and then vitamin and mineral deficiencies. So this is unfortunately a list of complications that can happen. And then to prevent these complications, again, avoiding gluten for life is recommended and really trying to limit any cross-contamination. So we have some examples. I have 2 diets listed. So diet A is a diet for breakfast, lunch, and dinner. And then diet B is also breakfast, lunch, and dinner. One of these diets is gluten-free and one is not. So diet A consists of cream of rice with butter, 2 eggs and orange juice, lentil soup with gluten-free croutons, lentil pasta and marinara sauce, a side salad with olive oil, balsamic vinegar, and water to drink. Option B is a gluten-free oatmeal prepared with water, 1 banana, and 1/4 cup of walnuts, chicken stir-fried with brown rice, bell peppers, broccoli, onions, and soy sauce, water to drink. And then for dinner, it'd be grilled salmon with asparagus, 1 baked potato with butter, and a glass of wine. So one of these meals is 100% gluten-free. And then just as a reminder, in order for someone to be adhering to the gluten-free diet, all of their meals should be gluten-free, not just some meals. So if you want to take a minute and think about which meal you think would be gluten-free, and then I'll provide the answer. So the gluten-free diet would be option A. All of these items listed in option A are gluten-free. And then we'll do another example. Option A is a smoothie made with Greek yogurt, almond milk, and frozen berries with peanut butter, mixed salad with grilled chicken, cucumbers, tomatoes, onions with olive oil and balsamic vinegar with water to drink. For dinner, grilled shrimp, corn, and steamed broccoli, 1 glass of wine. Option B is a bagel with cream cheese, orange juice to drink, turkey and cheese sandwich on gluten-free bread with lettuce, tomato and mayonnaise, iced tea to drink. And then for dinner would be a sirloin steak with black pepper, broccoli rabe, sauteed with garlic and olive oil, mashed potatoes, and a beer. So I'll give you a couple minutes. And then option A would be gluten-free. Again, the beer is not gluten-free, so that would have the gluten. The bagel has wheat, and then that again is not a gluten-free meal, even though the lunch would be gluten-free on the gluten-free bread, but all of the meals have to be gluten-free in order to comply. These are some resources that can be very helpful if yourself or a loved one or a friend has celiac disease. These are reputable sources. Nowadays, there's a lot of information off the internet or depending where you're getting your research from. So it is important to find reputable sources. This way you get the correct information that you need. And it's backed up by research. So these are some good really websites to visit. They have a lot of great information. Some may provide recipes. So this is some good information. I think the slides will be shared and you'll have this afterwards as one of the handouts to reference. So you don't have to worry about taking pictures. You're more than welcome to if you'd like, but you'll have access to this. And these were the resources, guys, as well. These are continue to be more resources. So it's definitely some more information than what it used to be early on. Once we had that label law come out in 2004, there's been a lot more information and more education towards celiac disease. More products have been available and more resources available, which has been very helpful for this population. And here we have my references. I'll hand it back over to you, Beatrice, if we want to go over just any Q&A.
Hi, Natalie. Thank you so much for that presentation. And I am going to open it up for everyone. If you have questions, please use the Q&A button or the chat box, whichever is more familiar to you,
Oops,
so that way we
sorry.
can, oh no, that's fine. So that way we can answer your questions. We unfortunately won't be unmuting anyone to ask questions. So please feel free to use the Q&A or the chat box for your questions. In the meantime, Natalie, what is one thing that you've seen with patients in your field when it comes to celiac disease that they struggle with the most?
That's a great question. I feel like they have a good understanding of what to eat and what to avoid after a couple sessions and going through the label reading. I find the struggle seems to be when dining out or at social gatherings due to cross-contamination. And certain staff members, you know, if you're at a restaurant, they might understand that gluten is an allergy, but just trying to communicate with the chef if the sauce is gluten-free, you know, if they're using something else as a thickener instead of flour, that can be an issue. I've had a couple patients after just coming back for a few sessions, they say, oh, I went out to a restaurant or I was out with a friend and I had a cross-contamination episode. And then generally they'll have the GI symptoms like the nausea or the vomiting. Those are the most common symptoms that I tend to see. But I would say being exposed from food outside the home is probably the biggest, just the biggest challenge that that population has.
I see. Thank you. We do have some questions coming in. Would you be able to repeat the first 6 slides?
Of course. Okay, so this was the first slide, just getting started. This was the managing celiac disease and eating right.
Maybe, I'm not sure if maybe they meant after the objectives.
Oh,
yeah.
Yes, so again, so celiac disease is an autoimmune disorder. So in autoimmune disorders, when the body starts to send signals to attack itself because it cannot differentiate between healthy cells and foreign cells. So celiac disease is genetic. So a patient has to have either the HLA/DQ2 gene or the HLA-DQ8 gene in order for them to have celiac disease. So it's genetic, the body is attacking itself. It really sends signals to attack the small intestine because that's where the inflammation is occurring, because that's where the gluten is getting supposed to be getting digested and absorbed, but it really isn't getting digested properly due to the signals that are being sent to the small intestine and because of the damage to the villi. So patients who do have celiac disease, generally it's because, again, the genetic factor, and then because it's a family member, whether it's a child, a parent, or a sibling having celiac disease. If it's within that immediate family, usually they have a further risk of developing it rather than having it be, let's say, an aunt or an uncle. There is an increased risk when it's within the immediate family. It can develop at any age after gluten is ingested. So if gluten is consumed as a toddler, it could happen then. It could also happen years later. They could have the gene, but then it starts, celiac disease might present later in life due to stress or a change. Something could bring on that autoimmune disorder just because, again, it is autoimmune. Before I continue to the next slide, is there anything on this slide that you want me to continue speaking about? If you have any questions, just if someone just wants to type in, if you want further explanation.
I haven't received anything yet.
Okay. And then, yeah, so this was the visual. So for any visual learners, this may be helpful so you can have an idea of understanding of what is occurring in the small intestine. So for a patient who does not have celiac disease, on the left, you'll see a picture of the normal healthy gut where the villi is standing up almost like hair-like follicles. So the job of the villi is to absorb the nutrition from our food. when a patient has celiac disease and they're ingesting gluten, what happens is the villi becomes flat. The flattened villi is not working properly, and then vitamins and minerals are not getting absorbed. And that's after the malabsorption, that's when we'll start to see weight loss, or some of those other complications and indicators that are really starting to be symptoms of the celiac disease because of that malabsorption. So again, celiac disease, the villi is flattened due to the inflammation and the body sending signals to attack the small intestine. The villi becomes damaged. Vitamin mineral absorption is compromised, where for a normal healthy gut, we're not seeing that inflammation. We're not seeing the villi get damaged with the ingestion of wheat. And then the vitamins and minerals are then able to be absorbed. And these are the most common symptoms that we see in children. Gastrointestinal symptoms are the most common. And again, that is because the small intestine is being compromised. That is where really most of our digestion occurs, is in the small intestine. So if the small intestine is compromised, we're not going to be able to see healthy gut function. So we have the nausea, the vomiting, constipation, and then just because of those GI issues and the vitamins and minerals not being absorbed, we then see issues with delay in puberty or failure to thrive. So that's going to be like a shorter stature that should be where the child should be for their age. It could also be involuntary weight loss, significant weight loss, or a person being underweight. They're having difficulty gaining weight and absorbing their calories and their nutrition through their diet. Other indicators for children is the anxiety and the depression, attention deficit hyperactivity disorder, also known as ADHD, some learning disabilities that may occur, damage to the tooth enamel, and that can just be related to, unfortunately, malabsorption. Calcium may not be getting absorbed. There's a lot of factors that could be leading to that. Fatigue, headaches, iron deficiency, anemia, just because, again, that iron isn't going to be getting absorbed. If diarrhea is present, we might see iron deficiency anemia secondary to diarrhea, irritability, seizures, lack of muscle coordination, short stature. And then we have the indicators for adults. Also, GI issues are very common. Same like with children, we have the abdominal pain, the bloating and the gas, constipation, diarrhea, nausea and vomiting, any mouth ulcers or canker sores, osteoporosis or osteomalacia, reduced functioning of the spleen, hyposplenism, and then weight loss. So these are common issues that we see in adults. I would say the most common that I have seen are generally, and this is for children, adolescents, or for adults, is usually the nausea, the vomiting, the diarrhea, abdominal pain, significantly across the board. And then with adults, more so the osteoporosis. I would say those are the most common. Other factors are listed here as well. What I have not seen is more the neurological conditions that can also occur. But generally, with the education that we have now and the resources available, because it has increased celiac disease over the years, I think doctors seem to be testing more frequently for it than what they knew previous years ago. So I think what it seems to be, again, just from what I've noticed in my career, is that when we start to see it sooner, we can treat it. They can avoid the gluten, and then the complications aren't really going to occur if they continue to avoid the gluten lifelong. So like I mentioned in my career, I really haven't seen the neurological conditions that can occur if it's left untreated. And I think that's mostly because we're starting to see it sooner, so we can become more active and diligent about treating it.
Thank you, Natalie. There are two other questions. Can you point out the problem foods in menu B on the first slide with the gluten-free diets?
Oh, sure. Yes. So the problem food, this was the first meal, would be the soy sauce. So, oops, sorry. So again, soy sauce can have wheat in it. So if a person is cooking at home or going out to dinner and they're having something like a stir fry prepared with soy sauce, even if the meat is gluten-free and all the vegetables are going to be naturally gluten-free, if they're using soy sauce, that meal no longer becomes gluten-free, and then that whole meal or that whole day is no longer adhering to a gluten-free diet. So gluten has to be avoided for life at every meal and at every snack. So gluten-free oatmeal prepared with water, banana, and nuts would be gluten-free. So breakfast checks off. Lunch would not be gluten-free because of the soy sauce. Dinner would be gluten-free because, again, gluten is not going to be found in any fish or vegetables, and potatoes are naturally gluten-free, as well as dairy products. Wine would be gluten-free, so that would be fine. But again, it's the soy sauce and B that makes that meal not gluten-free. When we look at option A, cream of rice, again, rice is a gluten-free grain, so that would be fine. Again, no gluten is found in any dairy products, or eggs are protein sources, so that would be fine. Gluten is not found in orange juice. And then any bean-based item like lentils, chickpeas, black beans, those would be gluten-free. And then this option for lunch on option A has gluten-free croutons, so that would be adherent to a gluten-free diet. If those were regular croutons, it would not be gluten-free. Lentil pasta is gluten-free, just a regular marinara sauce and a side salad with olive oil and balsamic vinegar is gluten-free. If this option had malt vinegar, then it would not be gluten-free. So that's where we have to be really careful with selecting certain ingredients. This way we're in adherence to having a full day of a gluten-free diet and then continuing that behavior lifelong. Unfortunately, with celiac disease, it's not a condition where you can have gluten periodically and not have the effects. Every time we ingest gluten with celiac disease, there is that, again, because it is an autoimmune disease, there are those cells going to the small intestine to attack. That villi gets damaged, and we're starting to feel the effects of that. So avoiding gluten for life is recommended, not just avoiding gluten for a couple meals. But yes, this one might have been a little bit tricky because of the soy sauce. And the second diet, option A, is all gluten-free. Again, dairy products, almond milk, any berries, nut butter would all be gluten-free. The salads are gluten-free because, again, we're using balsamic vinegar. Shrimp and corn are gluten-free, as well as the broccoli, and then wine would be fine. For option B, we have the issue because we're having a bagel. Bagels have a lot of wheat in them. They're made with flour. So breakfast would not be gluten-free. Lunch would be gluten-free because we're having gluten-free bread. But again, we have to have every meal gluten-free. And then the last option is the dinner. So the steak with black pepper, broccoli rabe. We're having garlic and olive oil, mashed potatoes, and beer. So in this menu for option B, B for breakfast is the bagel is not gluten-free, and the beer at dinner is not gluten-free. So so for the day's meal for option B, there's 2 meals that are not gluten-free. That would be breakfast and dinner, due to the beer at dinner and the bagel at breakfast.
Perfect. Thank you so much for going over those.
Oh,
There was a question about the lentil soup, which you had answered. So
right.
everyone's good.
And that's because of the gluten-free croutons. So if you're going to the grocery store, if you or someone you know has celiac disease, there are so many options available now. Some grocery stores have their own aisles of gluten-free products. I'm sure you've seen that doing the food shopping. Others are kind of mixed into the other products, like gluten-free cereal might be just in the regular cereal aisle, but there are gluten-free options available. So if that lentil soup was paired with regular croutons, that would not be gluten-free, but because they have the gluten-free croutons, that's fine. A lot of products that we see that are gluten-free now, like some gluten-free pasta or gluten-free croutons, they might be made with quinoa or rice flour. I find rice flour to be the most popular, any rice product, as well as corn. So they're using other grains or they're using beans to choose, or I should say, make that product instead of anything with wheat or barley. That's usually generally the swap.
Perfect. We do have a question. Flour in soup as thickener.
Yes. So unfortunately, if you are cooking at home or if you're dining out, I'm going to actually go back to this slide perfectly. Actually, it's the one before. Might have been after. There was a specific one. I'm sorry. I just want to find that and then I'll elaborate on that. Oh, here we go. It was this one. Okay. So if you are going to be having any soup at home or making a sauce or a roux, depending on what the recipe calls for, that product may not be gluten-free. And it might not seem very obvious because you're not actually seeing bread with it or rice, or pasta or a bagel, something that seems to be pretty obvious. But flour is generally used as a thickener. It does add just that thickened texture. So a lot of homemade sauces, if you're at home and you like to cook, you might make a sauce with flour, or if you're at a restaurant, they commonly will use flour to thicken a sauce. So I always recommend, if this is a concern to you or a loved one, just ask if that sauce is gluten-free or if it can be made gluten-free. If you're home and you're preparing sauces, I recommend the arrowroot. That is a great thickener. If you're at home making a sauce, it's not grainy, it mixes very well, it doesn't have any flavor. So that can be a great alternative to flour if you need to make something and thicken it. If you're making, let's say, a chicken cutlet or something else, and you usually were to be coating that with flour, let's say, and then you're going to, bake with that or whatever you were going to do. You can also use the arrowroot for that instead of using flour to coat meat and then bake it or fry it. You could also use potato starch or like rice starch, and that would be fine too. Those are also gluten-free, and I actually find them to be a little bit more work with friendly compared to flour, because flour can clump, where the arrowroot and the potato starch doesn't seem to be clumping. So you can get more of a smooth finish depending on what you're making.
Thank you. We do have a question about the lentil soup. Doesn't lentil soup normally have flour in it? You have to look for gluten-free lentil soup?
I think it depends on how it's being made. So that would just be depending on the ingredients because of whoever's making it. So if the lentil soup, I guess it really just depends. If it was made with broth, lentils, and carrots, and it was broth based, then it would not have flour in it.
Thank you. Let's see if we have any other questions. Again, you can use the Q&A for questions. And thank you everyone who has submitted their questions. It's been very informative. And let's see, I'll give it a minute or two to see if anyone else has any further questions. And Natalie, I loved what you said about what is changing currently with gluten-free. I know if I go to my local supermarket, there is a gluten-free aisle that I sometimes look at, because it's nice to also take away some gluten from your normal diet, even if you are not diagnosed with celiac disease.
Yes, we are seeing more gluten sensitivity, even if a person does not have celiac disease. And symptoms of that can be shown with like difficulty concentrating, as well as joint pain. I would say joint pain seems to be the most common from what I've seen. And gluten for some people can just increase inflammation. So when we have a lot of inflammation in our body, we're not going to be feeling our best. So that can be just something to take out. And then with the, so many different products on the shelves these days, we are seeing so much more gluten-free options, whether it's a gluten-free chip available or a gluten-free pasta or gluten-free bread. There are so many options that, and even if you don't have an issue with gluten, it might be good just to have a different variety and just try something new, just to keep, what we're eating a little bit more fresh and new, just so we don't get sick of eating the same things over and over.
Thank you. We do have another question. Would you recommend regular blood testing for those with a near relative diagnosed with celiac? I was told I do not have it despite many of the symptoms, but my son was diagnosed via biopsy at the age of 25. Okay,
so if they, what I would want to know, if they had a biopsy done at age 25 and they're having symptoms, I'd want to know how old are they now? Are they 30? Are they 35? Are they 26? Has it just been a year later? I'd want to know when that biopsy occurred, because again, celiac disease can develop at any point. So maybe at 25 they didn't have it, but maybe a few years later now they do. So I'd be curious to know the age of that patient. But I always recommend, if you're having symptoms, then avoid it. That would, your body's responding to it, and then at some point you may actually develop it. You could have the gene. I don't know if you were tested genetically, but if you were tested genetically, most times that gene does present itself, and then you end up having celiac disease at some point in your life. That was actually my story. I have a huge family history of celiac disease. When I was tested, it was negative. I was starting to become gluten sensitive, but I had the genetic test and I showed I had the gene. So it was a matter of time until I was going to develop celiac disease, have most of those symptoms. So my perspective as a dietitian, knowing the foods I had needed to avoid, I just decided to avoid them, feel better. And then if it never technically comes, then great. At least I'm able to have my quality of life and feel great. So that would be my advice to you. Maybe get tested again a few more years. And then in the meantime, I would recommend avoiding that. Anytime there's pain, that is a sign that something is going on in the body. So if you're taking out the gluten from your diet and you're noticing an improvement in your symptoms, then I would say you would want to avoid that. And then just because gluten is found in a lot of the grains, our grains are full of B vitamins. So it is important, if you are avoiding gluten, to make sure you are eating potatoes and corn and some of these gluten-free grains that I have on this slide. This way you don't have nutrition deficiency. Some people have avoided gluten as a way for weight loss, but you just want to make sure you're also introducing other foods that are nutritionally dense so you don't miss out on the B vitamins and food sources of fiber. Fiber will be found in our fruits and our vegetables, but having those grains will also add to our fiber requirements. And it does give us more B vitamins and folic acid, which is very important. So if you do have to avoid gluten, just make sure you're substituting with other grains regularly.
Thank you so much for that. Just to clarify for that question, the person that asked was not diagnosed. She would want to know if she should get diagnosed. Her son was diagnosed and tested and has been with this diagnosis for 3 years and has been monitored medically. So they're not exactly sure if they were tested genetically. So maybe what would they ask their provider? Would they ask their medical team if they were tested genetically? Is there anything that she can state to her medical team to get this genetic testing on top of everything that you just recommended if she is having these symptoms?
Yes, I would recommend speaking with your primary care physician first, and then seeing if they can order one of the tests that would be done, whatever method I would say you would prefer. I don't want to say go for the biopsy. It's a little more invasive, but if you feel like that's what you needed to do, you could try that. But I would say you have options. So go with whatever you feel comfortable with. And depending on your medical history, what your primary care physician recommends. And then it could also, if it's your son, I would also be concerned or question, is it coming from your side of the family, or maybe, the child's father's side, or, whoever's, if it's the mother asking and the father, or vice versa. But I would see, what side it's from. That's important too. So maybe both parents might want to go and check that out themselves and see. And then again, if you were doing any of the blood tests, you would have to have gluten. So unfortunately, if someone was having symptoms, normally we would say avoid gluten, but if you're going for a blood test, you do want to ingest and eat the gluten to make sure it's not a false negative.
Thank you. And that was what they had done, the blood test. So
Okay.
that was the recommendation. Thank you so much. I'll give another minute to see if anyone else has any further questions. And Natalie, as always, you've been so informative and helpful with all the questions. So thank you so much for that. I also will be placing a quick survey in the chat for everyone to fill out. So please fill out if you have a chance. It's only going to take about a minute or two. And I'm just going to wait another minute to see if there's any other questions. And I'll answer this question. Can we get a copy of the presentation? Yes, you will be receiving a copy of the presentation and a follow-up email to everyone that attended this program today, with also the link for the survey and other resources that Natalie has provided. All right. Well,
thank you.
Let's see. Well, there's no other questions that are coming in. So with that being said, thank you everyone for joining us. A special thank you to Natalie for dedicating your time and your expertise today. If anyone has any other questions or comments, please feel free to send us an email to communityhealth@atlantichealth.org or call us at 1-844-472-8499. That will conclude our webinar for today. Have a great day, everyone. And again, Natalie, thank you so much for your time.
You're welcome. Thank you. Thanks for having me. Thanks.